Welcome to the OVA vlog. We are here today at CDI Vascular Care and we're talking about uterine fibroid embolization. And we have two awesome guests and I'm very excited to dive into this content and to give you a little bit more information about fibroids and potential treatment. So welcome. We're here with Dr. Michael Cumming and Rose McKinney. Dr. Michael Cumming provides a procedure called uterine fibroid embolization, and Rose McKinney was a patient that actually underwent this treatment. So we're going to talk a little bit about what are fibroids, and then we're also going to talk about what this procedure is and what it feels like to go through it. So welcome.
Thank you.
Thank you. To get started, we just want to know a little bit about what are fibroids.
Right. So fibroids are benign tumors, which means they're non-cancerous tumors, and they're a collection of muscle cells and other tissue that grow in or around the uterus, and they can vary in size.
So
they can vary in size from as small as a grape to as large as a grapefruit, or even larger than that.
And the uterus is actually
Right, the normal uterus would be the size of a grapefruit in a premenopausal woman. It gets smaller in a postmenopausal, and so you can imagine adding doubling or tripling or even quadrupling the size of the uterus, the symptoms that can cause.
What are the common symptoms that a woman might experience?
So really two different kind of categories of symptoms. One is related to the size of the fibroids, and we call these bulk-related symptoms, and they can vary from low back pain to constipation to urinary frequency, so going to the bathroom frequently. They can have bloating type symptoms, so they feel very full all of the time. And then you can actually see them pushing out on the abdominal wall when they get really large. The other class of symptoms are bleeding related symptoms, and so those are people that have very heavy periods or very long periods or a combination of both.
Rose, do you want to maybe just talk a little bit about what your symptoms were?
Yeah. Essentially, as I am nearing menopause age, I was starting to have heavier and heavier periods, and that seemed kind of odd to me that they were getting heavier and lasting longer. So, for example, not being able to make it through the night, having to wake up several times during the night to go change because you're soaking through things, or not being able to sit in meetings at work for very long because, all of a sudden, too much. So as I was starting to continue to have those symptoms, I mentioned it to my doctor, and I sort of just mentioned it as an inconvenience, like, yeah, my periods are getting really heavy and lasting longer.
So how did they diagnose the fibroids?
My gynecologist, just through regular exam, so palpation, was able to feel, and then she said, I'm pretty sure that you have fibroids. And from there I went in and had an ultrasound which confirmed the location and the actual fibroids themselves.
Did someone recommend getting a hysterectomy? Is that what the
Yes.
procedure is typically to handle fibroids?
Yes, and from what I understand, there were a couple of different things that you could do depending upon where you were stage-wise with fibroids, how big they were, how many there were. But what the doctor said to me is hysterectomy. That's what you need to do, total hysterectomy. And I was just sort of taken aback that was the recommendation, that there wasn't a lot of discussion around the options. And so in going home and chatting with my husband, we both said, there's got to be something else.
Yeah.
Went online, did a little research, very quickly found out that there was something called a uterine fibroid embolization, non-surgical, outpatient, safe, quicker recovery time, and most importantly, save your uterus.
We've talked about this procedure, and we've talked
Right.
about how it's outpatient and has a short recovery time. What actually happens during the procedure?
Right, so the procedure involves getting the catheter, which is a tiny plastic tube, into the arteries going to the fibroids or to the uterus. And to the majority of patients, these are what we call the uterine arteries. We go into the radial artery and we guide this catheter down, and the artery is going to the uterus. And once we get the catheter in place, we inject tiny particles in fibroids. The particles go into the fibroids and block off the blood flow to the fibroids, which causes them to basically die and shrink and scar down.
How did you experience that?
First and foremost, it was pretty much a breeze. It went exactly like they described. You come in first thing in the morning, you get prepped, they give you some medication to relax you. There's no general anesthetic, so you're not asleep during the procedure, and yet you don't feel anything. You can talk, I remember seeing things up on the screen a little bit, and just being guided through it. Fairly quick, what, an hour maybe?
Yeah, typically 60 minutes.
About an hour. And then after that, you know, you recover. Now, there's a little bit of discomfort right after, because all of a sudden that fibroid isn't getting the blood supply anymore, and so there's discomfort from that, kind of like having really strong menstrual cramps.
Okay.
But through pain management, and knowing that that's gonna be a symptom for a couple of days, you're pretty much fine. Tired for a few days, it's almost like feeling like you have the flu.
Okay.
And so you go home and rest and take a little bit of time off, and fairly shortly start to feel much better. Now, I would say I experienced almost immediately, first period, great reduction in the amount of bleeding and duration of the period. By second, third period, I mean, completely a change. So talk about going from super plus to light in terms of tampons, complete, I mean, almost within a couple of periods. So from a lifestyle standpoint, really worth.
Yeah. Well, thank you both so much for sharing
You're
your
welcome.
experience, sharing the work that you do. And we just, as OVA, hope that if you are having fibroids, you just know all the options that are out there. And if the first thing your gynecologist says is that you should get a hysterectomy, definitely look into this alternative procedure, because you could potentially keep your uterus. So thank you so much, everyone. Thank you.
Thank you.